Good afternoon, everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I will discuss on a different topic, that is screening methods of analgesics. So, what is analgesia? Analgesia is act of relief from pain, and there might be two routes of action. One is central, another is peripheral. And the screening method provides a brief idea regarding the analgesic nature of the drug. So depending on the nature of stimuli, we can classify the pain stimuli as chemical method, electrical method, mechanical method, and thermal. So in chemical method, there are lots of examples, that is breathing test, Randall-Selito test, intra-arterial bradykinin test, formalin test in rats. And in electrical method, there is electrical stimulation of the tail, flinch jump test in mice, tooth pulp stimulation in rabbits. And in mechanical, there is Hafner's tail clip test in mice, and thermal, it is radiant heat method, that is tail flick test, tail immersion test, and hot plate method. So we'll discuss individually. So coming to chemical method, first is reading tests. Reading test, in reading test, the agent used is phenyl benzoquinone or acetic acid, and the solution given intraperitoneally in mice, that is IP route, and the reading calculated for 10 minutes. Stretching of the abdomen, reading means stretching of the abdomen with stretching of at least one hind limb, then percentage inhibition is calculated. And in this reading test, uh, and the pain is observed in both peripherally and centrally acting analgesics. We can use both peripherally and centrally acting analgesics in these reading tests. Then another one is Randall-Selito test. Randall-Selito test, the principle is that inflammation enhances sensitivity to pain, and brewer's yeast injected into the left hind paw of the rat. Then after 3 hours, pressure is applied through a special apparatus and pain threshold is calculated. And central and peripheral analgesics increase the threshold in inflamed paw, but opioid analgesics increase threshold in non-inflamed paw. So this is a chemical method of test. So this is the Randall-Selito test showing in the image. Then coming to intra-arterial bradykinin test. In this test, polyethylene catheter passed into carotid artery. Bradykinin injected the catheter, that leads to dextrorotatory movement of head, flexion of forelimb, and occasional squeaking. In the drug-treated group, minimum of 2 consecutive doses of bradykinin effect should be abolished, and both central and peripherally acting analgesics can be used in this test, that is intra-arterial bradykinin test. Then another test is formalin test in rats, mainly used for chronic pain and centrally acting analgesics, and subcutaneous injection of 10% formalin into the dorsal surface of the forepaw, leading to the elevation, licking, and biting by the animal. The test drug given orally or subcutaneously. Analgesic response observed indicated when both the paws are resting on the floor with no obvious favoring. So this is the formalin test in rats. These are the chemical methods. Then coming to electrical methods. Electrical stimulation of tail. A pair of alligator clips attached to the tail. Rectangular wave pulse of 40 to 50 volt is given. Frequency is 1 shock per second. The pulse duration is 2.5 millisecond and response time range is 3 to 4 seconds and registered at 15-minute interval. So effect of centrally acting analgesics, morphine, meperidine can be demonstrated by this method, that is electrical stimulation of tail, and it can also be used for NSAIDs, that is non-steroidal anti-inflammatory drugs and antagonists. Then another method is flinch jump test in mice. So constant current applied through grid floor in the form of square wave pulse at the rate 30 cycles per second for 2 milliseconds per pulse. Output measured in oscilloscope in milliampere. Initially mice flinch, then try to avoid by jumping. Pain threshold calculated before drug given at 15, 30, 60, 90 and 120 minutes. Both opioid and non-opioid analgesics can be tested by flinch jump test in mice. Then tooth pulp stimulation in rabbit. In tooth pulp stimulation in rabbit test, rabbit anesthetized with thiamantone sodium and upper incisor tooth pulp drilled. Through this rectangular current of frequency 50 Hz per second given. Current started at 0.2 milliampere and gradually increased until leaking. Then test compound given IV/orally and reaction determined at 15, 30, 45, 60 and 120 minutes. And the central analgesics are more tested than non-steroidal anti-inflammatory drugs in tooth pulp stimulation rabbit test. So then coming to the mechanical methods. Mechanical method, for example, Hafner's tail clip test. It is done for opiate, not for NSAIDs. It is done for opiate, but not for NSAIDs, that is non-steroidal anti-inflammatory drugs. And the test compound given either subcutaneously or orally. Artery clip applied to the tail 1 cm from the body. And time between onset of stimuli and response measured. Then response by biting the clip/tail near clip. And reaction time greater than the control animal signifies analgesic activity. So this is the Hafner's tail clip test. And then coming to the thermal methods, radiant heat method, that is animal put into cylindrical mouse holder with an opening at the rear end of for tail, light beam exerting radiant heat given to proximal third of tail, mouse react by tail pulling and head turning, drug given by oral/subcutaneous and reading taken at 30, 60, 120 minutes, and it gives the efficacy and potency of centrally acting analgesic. So centrally acting analgesic can be tested by radiant heat method. So this is the rat in tail flick apparatus given in the image. Then tail immersion test. Animal held in cylindrical rat holder with tail hanging out and lower 5 cm is marked and immersed in a cup of water at exact 55 degrees Celsius. Then reaction time taken with 0.5 second accuracy. Drug given by oral/subcutaneous and reaction time measured at 0.5, 1, 2, 3, 4, 6 hours. Withdrawal time is if more than 6 seconds, then positive response. It is specific for central analgesics and differentiate from peripheral analgesics. So this is a method, that is tail immersion test. So this is the picture showing the tail immersion test. Then hot plate method, that is Eddy's hot plate, that maintains temperature at 55 to 56 degrees Celsius. Animals placed over it and the time of leaking or jumping recorded. Drug given by oral/subcutaneous and latency recorded at 20, 60 and 90 minutes. It is usually done for centrally acting analgesics, and sedatives, muscle relaxants and psychomimetics can give false positive results. So we should be aware while doing the hot plate method. So this is the image of hot plate method. Then coming to differentiation of peripheral and central effect of analgesics. So in isolated perfused rabbit ear, rabbit anesthetized with pentobarbital, one ear connected only via great auricular nerve and ear perfused by oxygenated thyroid solution at the rate 2 ml per minute and at temperature 34 degrees Celsius. Bradykinin and acetylcholine given via perfusion system, and this system maintained for 6 to 8 hours. Drug given either the perfusate or IV oblique IP, that is intravenous oblique intraperitoneal. Systemic BP blood pressure recorded by transducer in carotid. Head flick response of facial musculature recorded by isometric strain gauge connected to incisor of rabbit. The local administration of NSAIDs, non-steroidal anti-inflammatory drugs, inhibit pain induced by bradykinin, but morphine fails. Systemic administration of morphine inhibit pain due to bradykinin, and it differentiates peripheral from central site of action of analgesics. So that's all for today. These tests should be done before after taking the ethics committee approval. So there should be some ethical reasons uh, for doing these tests, and the ethics should be maintained, and these tests should be done according to the GCP. So that is good clinical practice. So that's all for today, and we will discuss again on another day on another topic. So thank you for watching my videos and listening me. So please like, subscribe, and share the videos so that lots of people can know about these types of different topics. And you can also search in books and literatures, and also guidelines if there are any about these topics, and you can gain more and more knowledge. Thank you very much. Jai Jagannath.